Good morning and welcome to Talk Up Your Mind. I'm your host, Abeja Shirley, and today we're discussing the COVID-19 pandemic and how we can work together to combat it. Joining me today are
Public relations specialist from the Jamaica Greenpeace and
Zoe Williams, community leader.
Dr. Devonte Chambers from the Mandeville Hospital.
Hello, I'm Jonathan Rowe, a COVID-19 specialist.
Okay, thank you to all our guests and also to our audience for being here today. So, firstly, before we begin, I heard about the campaign that you guys are currently doing for the Ministry of Health called Health Shield Jamaica, Defending Our Nation. So, my first question is, what is this campaign about, Mr. Rowe?
Okay, so this campaign is basically protecting our Jamaicans, it's basically protecting them from COVID-19 and the diseases, and also the different types of diseases, not only COVID-19, but the Health Shield Jamaica Defending Our Nation. It's basically a campaign, it's an entity that safeguards the nation's health, and through public health initiatives, it also takes care of the healthcare services, and we advocate for safety procedures also. It works to improve health outcomes for Jamaicans. So that's basically our ideal motive with Health Shield Jamaica Defending Our Nation.
Okay, Mr. Rowe, thank you. Now, let's jump right into the basics with Dr. Chambers. Can you tell us a little history, a little background on COVID-19?
Thank you. So, firstly, now the COVID-19 pandemic, it first emerged in December 2019 in Wuhan, China. Now, it was caused by the novel coronavirus. Now, code name for this is SARS-C0V2, well, V-2. So the World Health Organization, which is known as WHO, declared it a pandemic in March of 2020. Now, the likely cause of this or the likely origination of this was from bats. It was then transferred to humans possibly through intermediate animal hosts. So meaning that the care and handle we give to humans, it's most likely the reason we got this disease. Now, primarily it spreads through respiratory droplets, and respiratory droplets, I must say, and can be spread through contaminated surfaces. Now, the symptoms from this ranges from very mild to severe. They can include fevers, cough, short of breath, fatigue, and loss of smell. Now, loss of taste and smells, I must say. Now, severe cases can lead to pneumonia, acute respiratory diseases, syndrome, which is known as ARDS. It can lead to organ failure as well as death in more severe cases. Now, the public health measures like wearing masks, physical distancing, hand washing, and avoiding large public gathering, they're very essential and it can help to mitigate the spread of the virus, as well as vaccine. It can also play a very pivotal and very vital role in preventing the spread of the illness and reduce the transmission of it to other persons. Well, and to be more precise, the pandemic has a I would say, very profound and I'll call it a dilemma situation on the health, the economic, and social impacts. And we can also look at it from the community standpoint where it's affecting the communities because students, they cannot go to school, they cannot gain I would say, a normal education. So it's become a very bad thing. And I would say to combat the spread of the COVID-19 pandemic, to reiterate, I would say the public health measures such as wearing masks, practicing physical distancing, washing your hands frequently, very frequently, and avoiding large gathering are very essential in preventing the spread of this, as well as taking vaccines. They can also help to mitigate the spread of this disease. And yes, so thank you.
Sorry. Okay, thank you, Dr. Chambers. Now, Miss Williams, how has COVID-19 affected your community?
Right. Okay, COVID-19 is a widespread illness that causes death and many different type of symptoms. And the thing is, with COVID-19 on the rise, it's overwhelming for my community. It leads to shortage of food and supplies, especially medical supplies. It affects the population, like with the vulnerability of the elders and the children. You know, most elderly people have underlying health conditions, so they're most affected by the fact that the COVID-19 is getting into their immune system. And then you have the economic factor where marketers, farmers, they can't really open and sell up shop, because the thing is, COVID-19 is creating a barrier of social distancing. So you can't really have people interacting and touching people like that. So sales are down, people are jobless. It's affecting how we work. And majority of people have to move on to online or find some alternative way to sell their products or goods. And then, as Mr. Chambers mentioned before, it's affecting the school system that we have, because now majority of the children in our community has to stay home for online, and the internet service is not accept accessible for every household. So we have to implement measures in getting great internet access to all the kids. And then there's another part where all of the members are being affected mentally, because they're depressed, they're getting anxious. A lot of anxiety is going around because people are dropping dead like every day, and everybody's wondering who could it be next, or what if it's going to be my family member, or what if I catch COVID-19. So it's been affecting the community in very drastic ways, major changes with the curfew, people going to bed early, people avoiding people. So I think COVID-19 has really affected my community, and so has the world.
Okay, thank you, Miss Williams. I completely understand. I have seen where COVID has caused a lot of implications for many people. So, Miss Node, you are the PR officer for the. Sorry, my internet. Sorry. I got start over. I completely understand, Miss Williams. I have seen where COVID has caused a lot of implications for many persons. So, Miss Node, you are the PR officer for the Jamaica Gleaner. What would you say is the current state of Jamaica's COVID-19 problem?
Thank you for that question, Miss Shirley. The current situation involves a fluctuating pattern of cases, and efforts to contain the spread is reducing. According to the Jamaica Gleaner, Jamaica has seen a total of 156,869 confirmed COVID cases and 3,756 deaths. Recent trends show 21% increase in cases, indicating ongoing challenges in controlling the spread. Factors contributing to this include insufficient vaccination coverage, variants of concern, and pandemic fatigue. It's imperative for the community to remain vigilant and adhere to the public health guidelines to mitigate further transmission. Now, some of the challenges in controlling the spread of COVID-19 in Jamaica include limited healthcare infrastructures, vaccine hesitancies, and difficulties in enforcing the public health measures. Now, Jamaica is a very, I would say, small country, so some of the hospitals, they are overloaded. So the individuals that are facing this illness, it's kind of hard for them to get treatment and whatever. And for the vaccine hesitancy, no, people are getting different information based on this. So people are hesitant to take the vaccine, and we are having difficulty enforcing the public health measures. I would say that individuals should promote social distancing, wearing of masks, and promote the vaccine because it helps a lot. It helps a lot. And to address these challenges, the Jamaica government and health authorities have implemented various measures that can include the lockdowns, wearing of the mask, as I said before, vaccination campaigns, which is very essential. And additionally, efforts are being made, such as increasing testing capacity, improving contact tracing, and providing support to the healthcare workers.
Okay, thank you, Miss Node. I understand. Now, can you tell us about the community COVID sensitization program and how it aims to combat the pandemic?
Now, the community sensitization program is a very comprehensive initiative that is designed to educate and raise awareness among community members about COVID-19, its transmission, prevention, and the importance of the vaccination, which is very essential, as I said before. This program aims to combat the pandemic by providing accurate information, dispelling myths, and promoting responsible behaviors such as mask wearing, hand hygiene, and physical distancing. Now, through interactive sessions, informative materials, and community engagement activities, the program seeks to empower individuals to make informed decisions to protect themselves and their community from the virus by fostering a sense of collective responsibility and solidarity. The community COVID sensitization program strives to reduce the spread of COVID-19 and it ultimately aims to save lives. Thank you.
Thank you, Miss Node, once again. And we will now go for a break. We'll return right after these messages. Welcome back to today's show. I'm your host, Sabeja Shirley, and today's topic is on COVID-19 and how we can work together to combat it. Now, what are some signs and symptoms of COVID and how is it treated? Mr. Rowe.
Okay, so some signs of COVID-19. Well, the most common symptoms are fever, chills, sore throat, and the less common symptoms are like the muscle aches and heavy arms or legs. You also have some severe fatigue or tiredness. You can also experience runny or blocked nose or sneezing. You can also experience some headaches, sore eyes, and dizziness. So all of these are components or symptoms of COVID-19. And to prevent it from happening, I think the best option is to get vaccinated or check with the nearest doctor or your family doctor to get more information on the different vaccines or the different type of vaccines included with COVID-19.
Okay, thank you, Mr. Rowe. Now, we're going to dive deeper into some areas that have to deal with COVID-19. Now, Dr. Chambers, can you explain the importance of vaccination?
Well, as previously as my fellow comrade Mr. Rowe mentioned, check with your family doctor to see that you're okay, to see what different things you need to do to ensure your safety. Firstly, I'd say that vaccination, as he stated, it builds immunity. Now it primes the immune system to recognize and fight the COVID-19 virus, which is I would say it's a very important thing right now because the virus is very widespreading and it's at a state where it's very detrimental to everyone's health. Now, as I carry on that sense, I would say it reduces the severity. Now, vaccination, I'd say it lowers the risk. I may seem compelled when I talk about this because I lost someone to the virus and it's very heart wrenching. So to carry on, I'd say the vaccination it lowers the risk of the severe illness, the hospitalization, and the eventual death from the virus, I must say. It also limits the transmission. Now, vaccinated individuals are less likely to spread the virus, which helps to control the spread of the disease to different communities, which is also very essential. This is what we're trying to prevent at the end of the day. Now, one community at a time will lead to the whole of Jamaica being protected from this deadly virus. Now, again, protect vulnerable population. Now, what I mean by this is the vaccination helps or it shields those, as you can see from our theme, shield. It helps to shield those who are at higher risk, such as the elderly and the immune compromised individuals. Now, this simply means that individuals who have very weak immune systems and they are much more likely to catch this virus. So it's very essential that we care for those individuals as everyone in general, but those individuals I would say much more because they are much more likely to contaminate get this disease and we need to protect them from very severe outcomes. And
Right.
to carry on further, I'd say it also helps to, taking a vaccine also helps to facilitate the reopening. Now, what I mean by this is in layman's term, the more persons take the vaccine, the more they follow different protocols that have been put in place, the more likely that, the country will be free again. It will be open up once more. It is very essential. This will be to more schools hope being open for our students to gain a regular education that we all so love for them to desire and to gain. Now, it also helps to improve the economy because we can all tell that our economical state right now is in a very deplorable condition. So we need to fix that at the earliest convenience as well as the public spacing. So that will lead into that. It will also improve our economy. Now, another very important thing we need to think about is the combating of the different variants of the COVID-19 pandemic. Now, vaccination helps to reduce the opportunity for these viruses to mutate because we kill them before they have a chance to spread or to mutate into something much more deadlier. And I would like to say it also helps to promote the global health because the more persons take the vaccine, the more likely it is that the virus will be gone in a jiffy, quickly. It'll be gone very fast, so that the world can return to what it was prior to this. So yes, thank you very much.
Okay, thank you, Dr. Chambers. Now, another thing that is important throughout COVID and this pandemic is sanitization. It is also a key component. So, Miss Williams, can you tell us some more about that?
Okay, so when it comes to sanitization, COVID-19 primarily spread through the respiratory system. So it works with droplets of water. So coughing, sneezing, talking, anywhere it causes like moisture to go inside your body, it can you can get affected. So these droplets can land on surfaces and anywhere else, it doesn't matter. And it can last for days up until hours. And the thing with the sanitization, when you sanitize frequently, it helps to prevent the virus from getting into your system. So you have to wash your hands. You have to wash your hands like every day. Make sure that you wash your hand at least 20 seconds and use sanitizers will have at least 60% alcohol in it to make it more effective to prevent the spread. All right. So proper hand sanitization is very important, especially when you're going out in public places, keeping your and you keep on touching surfaces such as railings, doors, and also touching your face and other people are talking to you, you need to keep a proper hand sanitization routine. And then there's another thing where it is very important because as healthcare workers, healthcare workers need this the most because can you think about a doctor if they're not washing their hands and sanitizing themselves, they will get the virus too. And if they get sick, who is going to take care of us as patients? So it's important for even healthcare workers to keep a very sanitary environment where they wash their hands and keep themselves very clean.
Thank you, Miss Williams. I completely agree with you. Now, Finally, let's talk about enhanced policies. Mr. Rowe, can you explain what these are and how they help us?
Good question, Miss Shirley. So, on the topic enhancing policies or enhanced policies. So basically, enhanced policies are a set of measures implemented by governments and organizations to address certain challenges posed by COVID. So these policies include like strategies such as increased testing capacity that will help to identify and isolate or cause more effective procedure to COVID-19. So one of the policies is the quarantine policy. All right, so the quarantine policy, it's an approach that requires individuals who have been exposed to the virus to isolate themselves and to prevent further spread. So it's basically isolating yourself, as I mentioned before, protecting yourself and others from the virus or the spreading of the virus. And another policy is the travel restriction. So travel restriction, it is another important component or crucial component. It aims to limit the movement of people from high-risk areas and reduces the spread of the virus. So enhanced policies, it includes public health guidelines such as mask mandates, social distancing requirements, and capacity limits for business and events. So all of this, the guidelines, it helps to, it designs basically design some procedures or rules to reduce the risk of transmission in public spaces and gatherings. Overall, enhanced policies, it is a crucial way of controlling the spread of COVID-19 and protecting the health and safety communities.
Mike.
Realize. Okay, thank you, Mr. Rowe. And that brings us to almost the end of today's show. Firstly, I want to thank everyone for sharing their opinions and expertise. Now it's time for our audience to ask questions. So let's jump right into our Q&A section. So I got a request from the audience to ask this question to the PR team, which is who is your sponsor you chose to fund this campaign and why did you choose that sponsor?
Yes, thanks for asking that question. That's a very important question because it's very well noteworthy that we, as in these troubled time, we partner ourselves with individuals who are able to help us in the best capacity necessary. Now, firstly, we partner with FAHO, which is short for the Pan American Health Organization. Now, to put it simply, these are regional officers for the Americans of the World Health Organization, which is short for WHO. Now, they focus on improving the health and the living standards of persons in America, and by further extension, the entire world at large. Now, they put it simple, they focus on improving health and the living standards of persons by providing technical correlation and mobilization of partnerships to improve the health systems, control and eliminate diseases, and response to emergencies such as the COVID-19 pandemic, for example. And we also partnered with CDC, which is short for the Center for Disease and Prevention Organization. Now, this organization is, as I stated before, it's a national public health institute for the United States, but they are a little bit different. They focus on the protection of the public health and the safety through control and prevention of diseases, injuries, and disabilities. Now, I'd say we can really look at the COVID-19 pandemic, and we can see there's a lot of falsifying of information, a lot of things that are not well or not right. And we've all seen this spread by different persons. And to put it simply, I like to say a lot of propaganda because it's very detrimental because, with the wrong information, it can put you in a space where things aren't logically right. So the falsifying of information, the propaganda that's being spread is very detrimental. We need to curb those things before it escalates to a profound level. Now, I'd say in concluding, both of these organizations they're very essential. They both do things that are well within our needs and our responses to this devastating pandemic. And I believe that together, FAO and CDC, they collaborate on various initiatives. This is why me and my organization and me and my team, we chose them because they align well with what we are trying to achieve and what we're pushing to achieve. So to improve the public health in our country, by extension our communities, and to share their expertise, their resources, and their best practices with us so that we can curb this spread of this disease, as well as eliminating the unwanted and unnecessary propaganda that has been spread towards our beautiful nation of Jamaica. Thank you.
Okay, thank you, Mr. Chambers. No, I want to thank you all for joining us today and for sharing your insights and your opinions. And also to remember everyone to let's work together to combat this pandemic, COVID-19. Get vaccinated, practice social distancing, sanitize regularly, support our communities. So until next time, walk good.